Afternoon, and thank you for joining us for this community briefing. Joining me again is interpreter Margie Propp, and thank you so much, Margie, for providing your services to our viewers. We encourage everyone to visit our website, covid19.lincoln.ne.gov. You can find our dashboard there that has the latest information, and we update that dashboard about each day at this time. You'll also find our COVID-19 risk dial, which is a color-coded tool that gives our residents an indication of the level of risk of the spread of COVID-19 here in Lancaster County. On that dial, red represents the highest risk factor and green represents the lowest. For each color, our health team provides specific guidance on the steps that all of us can take to protect our health and those in our community. We've been updating the COVID-19 risk dial each Friday, but because tomorrow's a government holiday, we have updated it for today. The health department team has determined that the risk of spread in COVID-19 in our community remains moderate. This means that the COVID-19 risk dial will stay in the middle yellow range for the fourth week in a row. As we see cases spike in so many other states, we are fortunate that our risk remains in this moderate range. That is the result of all of you taking so many of the necessary precautions and steps to prevent the spread of the virus. Thank you so much to everyone for what you're doing as individuals, as your families, in our businesses and other organizations. We could not have made this progress without you. We all, of course, need to remember that we still remain at risk of contracting the virus anytime we are out in public around other people. And of course, none of us truly know how the virus will affect us individually. Some people will have no symptoms, and some may find themselves fighting for their lives. This week, another member of our community died from COVID-19. The total number of deaths in Lincoln is now 13. Across the state, the virus has now claimed 276 lives, and on behalf of our city, I want to extend our condolences to all the family members and friends of those who have passed away. We feel that loss and we share in your grief. And with preventing further loss in mind and to help make it possible for our economy to rebound, for our children to successfully return to school in the fall, and to increase the chances that there will be Husker football and volleyball this year, please continue to practice the 3 W's. Wash your hands, wear a face covering, and watch your distance, keeping 6 feet between yourself and others. This is how we will continue to protect ourselves and our families and our neighbors from COVID-19 and keep our community moving forward. As part of today's update, we want to share that an additional 15 of our community members have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 1,766. Our total recoveries identified to date remains at 623. Health Director Pat Lopez is here, and she will now give us an update on all of our indicators and the position of the risk dial and how her team determined it. Pat.
Thank you, Mayor. As the Mayor said, we normally update the risk dial on Fridays, so the shortened week does impact the data that we have available. Test Nebraska also moved its testing days in Lincoln back to midweek, so that impacts the number of results we can report. However, the risk dial is based on the past 3 weeks of local and regional data, along with any current local situations to consider. And we are confident in our decision to leave the dial at the mid-yellow moderate level. We again review the 5 key factors that we consider when considering the position of our COVID-19 risk dial. First is the number of local and regional COVID-19 cases, and whether the number is increasing or decreasing. We have generally seen a decline in the cases since the week ending May 23rd, with about 250 new cases reported. For the week ending June 27th, we had 86 cases. So far this week, we are at 73 cases. We won't have the complete weekly count until Saturday, but we do expect a slight increase in the number of cases this week over last week. The 7-day rolling average for the past 3 weeks has flattened to about 13 cases per day. Last Friday was about 17 cases per day. Because this rolling average is updated daily, we can see the most recent trends. When we look at the breakdown by age group, we again see an increase in the number of cases in the under 40 age groups. Overall, 40% of cases are under age 40. But of the 289 cases reported over the last 2.5 weeks, 70% are under the age 40. In our case investigations, we continue to hear that many of these individuals have been to bars, attended large social gatherings, played team sports, activities without masks or face coverings. We are concerned about the risk of transmission from these younger individuals to their parents, grandparents, and others at risk for complications. We continue to monitor this situation closely to see how recent public events and additional easing of the directed health measures might impact the spread of the virus locally. Another factor in determining the position of the risk dial is our ability to do contact tracing, and our capacity remains high. These investigations are very important steps to control the spread of disease. If we can identify potential clusters of cases, we can prevent future outbreaks. I want to thank the school nurses who have been helping us do contact tracing and wish them well as they prepare to return to school. We are working to replace these nurses, and we have been accepting applications for new contact tracers. And many of the school nurses have notified us that they will continue to work with us after school hours and on weekends. This will help us as we prepare for any potential increase in new cases. Another factor in determining the risk dial position is the capacity and availability of testing in the community. In the month of June, just over 11,000 individuals were tested for COVID-19 in Lancaster County. This is down from a high of nearly 12,000 individuals tested in the month of May. Over the holiday weekend, fewer testing hours are being offered, so we do anticipate a decline in testing this week. But moving forward, we do hope we will continue to see a consistent average of at least 2,500 people tested per week. Again, we have the availability and capacity to do more testing, so we continue to encourage people to sign up to get tested. You can start by contacting your doctor or by filling out an online risk assessment at chihealth.com or bryanhealth.com to get an appointment for a drive-through test. Test Nebraska continues to offer COVID-19 testing to all of Lancaster County residents, even those with no symptoms. Test Nebraska will be available in Lincoln next week on Wednesday, July 8th, and Thursday, July 9th at North Star High School. The hours are from 8 a.m. to noon and 1 to 5 p.m. This testing is also done by appointment only, and you can begin the process with a free online risk assessment at testnebraska.com. Now let's look at the positivity rate. As the number of tests and the number of positive test results have leveled off over the past few weeks, we have seen the positivity rate steadily decline. This rate on June 1st was 7.4%, and the rate on June 30th was down to 6.4%. This week we have seen a slight increase. Today, the overall rate is up to 6.5%. The state rate is down from 10.8 to 10.6, and the national rate remains at 9.9. The rate of positivity is an important indicator because it can tell us whether enough testing is being done to find cases. If the positivity is high, it suggests that a community may largely be testing the sickest patients and possibly missing milder or asymptomatic cases. A lower positivity may indicate that a community is testing patients with milder or no symptoms. When the number of tests completed being consistent, it is a good sign we have seen a steady decline in the positivity rate locally. The status of the healthcare system is another key factor, and this continues to be a strength for our community. We continue to see a decline in the hospitalizations with COVID-19. As we begin the month of July, we are at the lowest number of hospitalizations since March. Today, the hospitals report 13 COVID-19 patients hospitalized. This includes 18 Lancaster residents and 5 from other communities. In summary, our health department team sees no significant change in key indicators. But while the risk remains moderate in the community, we continue to monitor our local situation. We are ready to mitigate any surge in cases like those we have been seeing in other states after the easing of restrictions. In assessing the risk, our department continues to work closely with our local businesses to provide information and guidance for keeping their employees and customers safe. Our COVID risk dial gives them a guide to plan and implement their protocols and mitigation strategies during the pandemic. Our staff has interacted with hundreds of businesses over the past 2 months, and I really want to thank our business community. Most of our local businesses that are currently operating have implemented safeguards to protect employees and customers. This does mean, however, that each of us has the responsibility to protect ourselves and make the best informed decisions. If you consider the risk of exposure and don't feel comfortable, you can choose not to participate in gatherings or events. You can choose to avoid businesses that are not following preventative measures. No matter what activity you're hoping to resume, your risk will depend on a number of factors. The first is contact intensity. Think about how closely you will be to other individuals and for how long. You are at the highest risk if you are indoors or in a crowded space for a prolonged period of time. Also consider if you're going to be close to others while speaking loudly, cheering, or singing. A second risk factor is the number of contacts. Smaller gatherings and fewer people are the lowest risk. The third factor is mitigation. Think about how you can reduce risk by moving an event outside, using physical barriers, spacing 6 feet apart at a gathering, and wearing a mask. Common sense tells us that as more activities are occurring, exposures will rise. It is most likely we will see an increased rate of transmission. That's why we should continue to limit interactions and take necessary precautions of physical distancing, wearing a mask, and washing your hands. Finally, please consider getting tested. In many communities, we are seeing long lines for testing. Here in Lincoln, testing is available for anyone, even if you have no symptoms. Again, just visit testnebraska.com to schedule an appointment.
Thank you, Director Lopez. So those 3 risk factors, contact intensity, the number of contacts, and our own mitigation efforts, those are especially important to consider as we enter a holiday weekend. And as we celebrate our nation's independence, it certainly can seem ironic that we are being called upon to limit our activity. Yet limiting our activity around others outside our household, or limiting the size and closeness of our gatherings, means limiting our exposure to the virus and preventing the spread of COVID-19. And because our success in preventing the spread is inextricably linked to our economic recovery and ability to send our children back to school in the fall, the steps that we take directly impact our ability to increasingly enjoy our independence and freedoms in the coming weeks and months. So taking these common sense precautions of keeping your celebrations small and outdoors, being careful about sharing food and drinks, staying 6 feet away from other people, and wearing masks. By taking these precautions as we celebrate, it's just really one of the most significant ways this year that we can express our love of country and community. Of course, the 4th of July holiday brings some risks for us as well, not related to the pandemic, and we want to share our annual reminders on how we can all stay safe around fireworks. I think most of us have already started to hear them going off in our neighborhoods. Legally, the sale and use of fireworks is not allowed. It's allowed only from 8 a.m. to 11 p.m. tomorrow, July 3rd, and from 8 a.m. to midnight, July 4th. Please only use legal fireworks and be considerate of your neighbors. To report fireworks violations, you can call the police non-emergency line at 402-441-6000, but please only call that number if you have an address or a description of the property. Also, please consider those for whom holiday fireworks can be especially difficult, including many of our veterans who fought to protect our freedoms. And we all know that children and especially big kids like my husband, maybe yours, love fireworks, but it's best that for kids to watch and not touch. Please give kids glow sticks and leave the fireworks to more experienced, responsible adults. Those lighting fireworks should not wear loose clothing and should not point fireworks at homes or other people. Watch for any fire hazards like leaves or dry grass, and have a fire extinguisher or water hose nearby. If a firework does not go off, stay a safe distance away and use water to make sure that it doesn't explode. And what you do after your fireworks are over is also really important. The Keep Lincoln and Lancaster County Beautiful organization urges us all to start with a boom and end with a broom. And remember that litter that is washed down storm drains flows into our waterways, and that the substances in fireworks can pollute our water and harm aquatic life. So cleaning up litter is essential to a healthy environment, and it demonstrates, of course, your efforts to be a good neighbor. It's a good idea to leave your fireworks alone for a while after they are fired, and to use water to make sure they are completely out. Cooled firework debris should go into your trash. Please do not take it to a city recycling collection site. The Lincoln Bureau of Fire Prevention is again offering a free collection event for unexploded fireworks and ammunition. That's set for 8 a.m. to noon on Monday in the east parking lot at Oak Lake Park. Our final precaution about the 4th of July has to do with air quality. The fireworks smoke that lingers in the air does present health concerns. That's why our health department has issued a health advisory. It went into effect this morning and will remain in effect through Sunday morning. Because of the smoke, Lincoln's air quality index often reaches peak levels that are unhealthy for everyone in our community, but especially dangerous for those with heart disease, asthma, and other respiratory conditions. People at risk should avoid extensive physical activity outdoors or remain indoors with windows and doors closed. The health department monitors air quality 24 hours a day, and the air quality index for Lincoln is updated hourly, and you'll find it at lincoln.ne.gov, keyword air. Again, we urge residents to keep health and safety in mind over the weekend. You can have a lot of fun while preventing injuries and, of course, preventing the spread of COVID-19. Moving on to our next topic, I want to highlight that one of the local institutions that has played a huge role in helping our community address the pandemic is our Community Health Endowment, or CHE. Since it was established in 1998, CHE has been working to make Lincoln the healthiest community in the nation. Over those 22 years, CHE has invested nearly $33 million back into the community and brought us all together to address key health issues facing Lincoln. CHE has stepped up its efforts during the COVID-19 pandemic. CHE was a major investor in the Lincoln COVID-19 Response Fund, played a significant role in moving women and children experiencing homelessness into safe housing, and provided quick response funding to help nonprofit organizations meet the unique needs created by this pandemic. Since March, when the CHE Board of Trustees temporarily suspended its regular grant cycles, CHE has granted almost $200,000 to meet the needs of our community. I am very pleased to tell you that CHE's Board of Trustees is announcing today that they are creating a new resiliency fund that will support Lincoln during the unusual times in which we live. In doing so, they will continue to focus on making Lincoln a healthier place to live, work, and play for all our residents. As a municipal endowment, CHE is unique in the nation in its structure, and we are truly fortunate to have CHE as an asset and a catalyst for building health and resilience for a bright future. With us today to give more information are Lori Seibel, CHE's President and CEO, who will speak in a few moments, and Kim Moore, Vice Chair of the CHE Board of Trustees and Chair of the Funding Committee. And with that, I'll turn it over to Kim.
Thank you, Mayor, and thank you for your strong and compassionate leadership during these very, very unusual times. Thank you very much. Well, the CHE Board of Trustees has been meeting by Zoom, of course, since March to discern our investments into the community and how they can have the greatest impact in helping Lincoln to respond and recover from the COVID-19 pandemic. At our most recent meeting, the board approved the establishment of the CHE Resiliency Fund to provide $2.5 million over the next year toward that recovery. The Resiliency Fund will complement the efforts of the Lincoln-Lancaster County Health Department, city leadership, state and federal initiatives, and medical professionals as Lincoln's nonprofit and public agencies move forward from urgent pandemic response through recovery to a resilient, thriving community for all. CHE recognizes the great challenge the pandemic has presented to our community and to the people who share our mission of making Lincoln the healthiest community in the nation. In addition to establishing the Resiliency Fund, the board established 3 new funding priorities: health equity, human connection, and embracing opportunity. This pandemic has shone a harsh light on the health disparities that exist in Lincoln long before COVID-19 became a part of our lives. According to the Robert Wood Johnson Foundation, health equity means that everyone has a fair and just opportunity to be as healthy as possible. Data clearly shows that people of color have been disproportionately affected by this disease. Through our health equity priority, CHE will focus funding on understanding and addressing health disparities that affect people who are marginalized or excluded due to race, ethnicity, or socioeconomic status. Examples of project areas that could fall under this health equity priority include, but are not limited to, identifying and measuring health disparities and social inequities, investing in health and social infrastructure that fosters equity, and establishing and empowering programs and systems that promote health equity. And we strongly encourage any agency that is interested in applying for funding under this health equity priority to involve the people who are most affected by health inequities in the design and development of projects intended to reduce disparities. Due to physical distancing and the necessity to encourage to stay home and stay safe, COVID-19 has isolated many in our community who were already vulnerable. A thriving community is rooted in human connection, and COVID-19 has put more at risk than ever. Even before the pandemic, we knew that loneliness is at the root of many public health threats, including alcohol and drug addiction, suicide, violence, mental illness, physical illness, and cognitive decline. Social isolation has been linked to a 50% increase in dementia, a 29% increased risk of heart disease, and a 32% increased risk of stroke. The damaging effects of loneliness on health are not restricted to any age or ethnic group. Based on the variety of studies, Dr. Vivek Murthy, former U.S. Surgeon General, reported that the impact of social isolation and loneliness on longevity equals to that of smoking 15 cigarettes a day and exceeds the risks associated with obesity, excessive alcohol consumption, and lack of exercise. The physical distancing and social isolation resulting from the COVID-19 pandemic have highlighted our need for human connection, and without an intentional response could result in long-term, serious consequences for our community. Under this human connection priority, CHE will focus funding on addressing the impact of social isolation and vulnerable populations. Examples of project areas that could fall under this priority could include, but are not limited to, building stronger individual and family connections, building stronger neighborhood and group connections, including intergenerational connections, and building high-quality community connections. Lori Seibel, President and CEO of CHE, will provide more information about our third priority, embracing opportunity, and about the application process. Before I turn things over to Lori, I would like to add that I strongly believe that the Resiliency Fund, our new funding priorities, will help make it possible for Lincoln and all of its residents to come back stronger and healthier than ever before. Thank you.
Thank you, Kim, and I want to offer a special thank you to the Board of Trustees of the Community Health Endowment, including Pat Lopez, who you just heard from, for their insight, for their service, for their thoughtful leadership during this very difficult time. It's your dedication that makes sure that Lincoln is going to share in good health and prosperity for many years to come. As Kim mentioned today, CHE is announcing some new funding priorities, the two that Kim mentioned, health equity and human connection, but also a third, embracing opportunity. And that priority was directly informed by conversations that we had with local nonprofits at the early and intense period when coronavirus was impacting our community. We reached out to each of them. We asked them, we wanted to know how COVID-19 was affecting them and their organization, and we asked them to give us 2 words that might explain how they were feeling at that particular time. Most respondents gave us a word that was generally positive, and one that was generally negative, things like cautiously optimistic or stressed but hopeful. What we heard were that there is optimism, there was hope, and the word cloud that you see on your screen really reflects the words that we heard, and the larger the word, the more times that we heard it. So what our grantees, the nonprofits in this community told us is that while challenges related to this epidemic and this pandemic are real and many, there's also opportunity, and they have seen that. They have formed new partnerships, they have formed new relationships, they've been creative. I can't tell you some of the creative responses that I've seen. They've been innovative in how they have delivered services. They've changed the scope of their work to be more responsive. They've increased their visibility and value in the community. They essentially have found new and promising ways to do their business. And that is something that we should all be very proud of our nonprofit community for doing. But we want to take hold of these lessons learned. We want to take advantage of what they have experienced during this period and support new ways of operating and serving clients. So examples of projects that we might be able to fund are creative and innovative service delivery, non-traditional relationships, building relationships with people that you hadn't thought of before this pandemic, perhaps technology solutions, how you've been able to incorporate technology more deeply into your work, or staff retraining or program realignment, things that have changed and things that we've learned as a result of this pandemic. So with up to $2.5 million available in this resiliency fund and those 3 funding priorities to guide us, we will resume grant making this fall. Applications for these fall grant cycle will be completed online and due to us by Friday, August 21st. We will have an applicant workshop via Zoom, of course, on Wednesday, July 15th for anyone who is interested in learning more. That will be at 2 p.m. And any information about the Resiliency Fund, our priorities, the process, the application workshop, just head to our website, which is www.chelincoln.org. And again, I want to express my thanks to the city, Pat Lopez, the mayor, the people who have had a steady hand during this period of time, of which I know we will all emerge stronger and better.
Thank you so much, Lori, and thank you, Kim, and to the Board of Trustees at the Community Health Endowment for your leadership and for your thoughtful, generous, nimble, and strategic response to the challenges that our community faces. And thanks as well to all those who will take advantage of this fund and use those resources and transform them into better health and life outcomes for the people of Lincoln. Thank you. We're going to wrap up today's briefing with some good news that will be welcomed by children and parents across our community. All 89 of our city playgrounds will soon be back open. Over the last couple of weeks, our Parks and Rec staff have been busy carefully inspecting each and every playground to make sure that they are safe to reopen. Once they were given the okay by the playground inspector, the fences came down and the swings went back up. The goal is to have all the playgrounds open by the 4th of July weekend, and our Parks and Rec crews are on target to meet that goal. At each playground, you will find the Play It Safe reminders that you need to continue to be careful to prevent the spread of COVID-19. We are asking those using playgrounds to please wear a face mask, stay 6 feet away from others, and to wash hands or use hand sanitizer after playing on a playground. The park restrooms and drinking fountains will remain closed for the time being. Thank you to our great Parks and Rec team for all they have done to follow the recommendations of experts to keep the public safe over the past few months. And we urge the public to continue to follow all the precautions and to play it safe at our playgrounds and parks and on our trails. And with that, we'll open it up for questions from the media.
Mayor, this is Bill with 1011. I have a question for Pat.
Okay.
Good afternoon, Bill.
Good afternoon, Pat. I was wondering if the county has been able to identify any new clusters, and then also how the previous clusters at Smithfield and Universal Storage have been over the last few weeks.
We have seen no real changes from the Smithfield or Universal Storage over the past week. Oh, excuse me, Bill, one case from in Crete, but none in Lincoln over the past week. And then no new clusters. And I believe I mentioned the other day that with this younger age group that we're seeing the majority in, we're really carefully tracking where they've been to identify any common locations or any places we may need to alert the community to.
But nothing worth alerting so far.
No. We wouldn't wait until today just to let you know. We'd be sure we got that message out.
I know
But
you so much.
we are watching closely.
Director Lopez, a follow-up to that. Have any particular bars been problematic, or have there been any number of cases that are tied to one establishment that your health department would have jurisdiction over?
No, not, that's what we're watching right now, Riley, to be really conscientious about that since we're seeing increased activity. We've had an opportunity to do more education with some of our bars about what the directed health measures are and how they need to be able to follow them in their establishments, and we will continue to do that.
Can you give an example of some of the course correction that it sounds like those education sessions would include?
People are to be seated at the bar unless they're out playing a video game, ordering food or drink. We don't expect to have people standing shoulder to shoulder in the bar. Their capacity needs to be limited in that respect to the 6-foot physical distancing. We do expect the servers in the bars to be wearing face coverings. And by and large, that's actually what is happening in most of our establishments, but we have had to have some conversations with a few just to have that opportunity for education and discussion back and forth.
Riley at the Journal Star again with a question for Lori Seibel.
Hi, Riley.
Hi, good afternoon. I just wanted to make sure I understood a little bit more about the new fund. Is this new funds that the Community Health Endowment is receiving, or is it a redirection of existing funds to this directive?
It's actually a little bit of both. At a time when I think the board had an opportunity to decrease funding because of the market situation, they chose to actually increase funding because they understood the needs that were in the community, as well as redirecting some funds from our current priority areas. What the board was not particularly interested in right now was starting new programs and projects without having the opportunity to really see how we could impact the recovery and the resiliency from COVID first. So it's a little bit of both.
As a follow-up, how does this how does this effort compare with the effort of the community health or of the Lincoln Community Foundation's efforts to support the nonprofits? It sounds like you're going to be doing a little bit of different work with than that fund that they have for the pandemic address.
Right. Yeah, another good question. I think that the COVID Response Fund, of which I serve on that committee, has been really intentional about getting money to people quick to respond to really COVID-related urgent needs. So, for example, people who were seeking food, people who were looking for rent assistance, utility assistance, organizations that were looking to provide some operational funding. So things that were very immediate and related to the pandemic were the focus of that and continue to be. This fund is looking at how we continue to create long-term change. So, for example, health equities. We know that the individuals who have experienced COVID, for example, in the African American and Hispanic population, clearly outpace everyone else. And that is symptomatic of a lot of things in our community. And so how do we change that? How do we create a system in which health equity or the opportunity to be healthy exists for all? So those are long-term, really intentional, very strategic kinds of problems to be addressed, as opposed to just immediate funding, which was, of course, is very important as well.
Thank you, Lori. Any other questions from the media? I just wanted to take a minute to clarify that in the report on hospitalizations, there were 8 from Lancaster County and 5 from other communities for that total of 13. And just wanted to clarify that. But any other questions? All right, with that, thank you so much for tuning in to this briefing. We hope you have a safe and healthy 4th of July weekend, and please take care of yourself and everyone in our community.